Hey everybody, I got this because I like to wander. I've noticed whenever I give talks at podiums standing like this, they're like universally worse. So I'm just gonna do it like this. That's the title of my talk, and it's on fire because that's like my visual representation of a hot topic. So we're gonna talk about AI today. I'm John, I'm Canadian. Okay, so I always start like this. All right, let's actually do this. Hands up if you're like a microbiologist. Hands up if you're a chemist. Hands up if you're something else. Hands up of those who are something else, computer scientists. Okay, so there's probably like some virologists and stuff. Yeah, okay, cool. All right, so we've had antibiotics for 100 years. Alexander Fleming famously discovered penicillin by accident in the summer of 1928. And since then, penicillin has probably saved 300, 500 million lives, something like that. We can see, if we look across this timeline, our discovery of different structural and functional classes of clinically used antibiotics, it's not sort of like equidistant as a function of time, right? We can see that the most of our antibiotics were discovered between the 1940s and the 1960s. This is the golden era of antibiotic discovery, characterized by a high productivity in discovering different structural and functional classes of antibiotics, largely derived by screening secondary metabolites produced by soil-dwelling microbes. You can see, middle of the 60s-ish, our ability to discover antibiotics through this approach decreased because we kept finding the same antibiotics over and over again. So we've turned to other approaches, largely medicinal chemistry-guided optimization of existing scaffolds. But in terms of true novelty, we haven't really discovered anything broad spectrum since the late 80s, right? There's been a couple one-offs more recently, narrow spectrum, highly targeted antibiotics, recent anti-gonorrhea drugs, for example. But by and large, since 1987, we haven't discovered a novel, broader spectrum class of antibiotics. Now, this discovery void, right, wouldn't necessarily be a problem if it existed in a vacuum, right? But it doesn't exist in a vacuum. Bacteria evolve resistance with clinical implementation of drugs, right? So we're in this really precarious state where we have rising resistance and a lean antibiotic pipeline and, right, really a lack of financial incentives for large pharmaceutical companies to work in this space, right? So what do you do? Right? Oh, and I'll give you a stat. 1.3, 1.4, somewhere in there, million people a year die from drug-resistant bacterial infections. That number is going to grow to roughly 8 million a year by 2050. So that's sort of the scale of this problem. Right? So lean pipeline, rising resistance, nobody wants to pay for it. What do? Right? Well, in a perfect world, we would be in a position to discover new antibiotics, right, rapidly because we know that every antibiotic we clinically employ will succumb to resistance. And what we want to do is outrun resistance if possible. And two, we need to make this dirt cheap. Does that make sense? So what do? So, how I think about this, and everything I say today could be wrong, right? This whole application of AI for drug discovery thing, this is still an experiment. So I'm going to teach you, and then you pick out the pieces that you want. So the idea is that artificial intelligence algorithms allow us to explore much larger chemical spaces than we could in a laboratory for new useful chemical matter. And you can see I wrote sort of here. And it's because, imagine this is a big representation of chemical space, right? Let's say, and we're going to get to this later, I'm going to make this concrete. Every star on this slide is a different chemical. And just for sake of argument, stars that live close together are structurally similar, okay? And then stars that are far apart are very different. Let's say, and we're going to get to this in just a sec, let's say these are the chemicals on which we train some AI model, right? We're trying to understand chemistry in the context of some property. The best an AI model can do, if this is the chemical space that we're training on, it might be able to make reasonable predictions out to here. But it will not be able to make reasonable predictions out to here because it's too far away from what it was trained on, right? That's why I say sort of, right? Because there's a lot of hype in this field, people saying, oh, we can explore all the chemical space ever, and it's like you can't because your model's guessing. Like the analogy I like to use, it's like if I take a microbiology student and put them in like a 4th century Japanese literature class, they're not going to do very well. But I can take a microbiology student, put them in an organic chemistry class, and they'll be okay, right? It's sort of like that. But anyway, right, in order to get an idea of how much more chemical space AI can explore, high throughput screening, we can look at millions of molecules in a lab, right? A couple million is our upper limit. In vitro success rate of less than 1%. With a reasonable AI model, we can easily look at billions, and based on empiric success rates in our lab, we're north of 10% regularly, right? Okay. So we're going to talk about 2 flavors of AI today, discriminative modeling and generative modeling. Discriminative modeling looks like this. I'm going to take a model, I'm going to train it on pictures of cats and dogs from the internet. I'm now going to go, after it's trained, get brand new pictures of cats and dogs it's never seen before, and if my model learns something, it will classify cats as cats and dogs as dogs, right? It's discriminating between data that I'm showing it, right? A generative model, on the other hand, satisfies this use case. Here's 1 million pictures of cats I'm going to train you on. Once you're trained, draw me a brand new picture of a cat that you've never seen before, but I have to look at it and know it's a cat, right? Generative models create data based on what it learned during training. Okay, so we're going to talk about both today. All right, so here's the thing. When folks start using AI for anything, there's this, like, they get antsy and they try to jump into the model right away, right? Which you shouldn't. And it's because here's 3 things. If you walk away from today with one thing, remember this. Quantity, quality, and biological relevance of training data dictate whether some AI model will succeed or fail, right? So 80% of your time should be focused on data. So the first thing that you need to do whenever you go into some AI-guided antibiotic discovery or whatever effort is focus on training data. So here's some training data. It's a bunch of molecules screened against Acinetobacter, okay? So you can gather a training data set like this in the laboratory, and what you can do is you can take that training data set and split it into 2 bins. Either the molecules did not inhibit the growth of bacteria in a dish, or they did. So this is really messy and difficult to look at, but now we've done, something to try to make it a lot simpler. So right now we have 7,500, roughly, structures with an associated property. Either it didn't do the thing or it did the thing, right? Well, now we're in a really unique position because we can show this type of data to an AI model and predict whether a new molecule will either be a 0 or a 1 just based on its structure. Does that make sense? Can someone nod? I can't see. Okay, good. All right, so this is basically what we're doing. We're taking the structure of a molecule, and with the data that's inherent in the structure of that molecule, we're doing something to output a single number between 1 and 0, right? Because that's what we've trained the model to do, right? Okay. So I'm not going to get into the guts of this because it's annoying and it sucks and it's super boring, but find me after. But if we look at the structure of that molecule, chemical structures are complicated, right? There's like atoms and bonds and all kinds of stuff. And computers don't like to think like that. They like to think in numbers. So what we first need to do is take the structure of a molecule and convert it into a long string of numbers. Imagine every circle here is a different number that are all stuck together. So this is a vector. A bunch of numbers stuck together is a vector. Is a vector representation of some molecule like this. And in computer science, here's something you can be fun at bars now. This is called the graph structure of a molecule, because in computer science, graphs are nodes connected by edges, atoms connected by bonds. So here's the graph structure of a molecule. And then we have vector representations of molecules. That vector representation then serves as an input into some AI model, who cares? And what this model is going to do is take this vector representation and collapse it into a single number between 1 and 0, depending on how confident the model is that the input molecule was indeed antibacterial, right? Just for the record, there's a million ways to go from structure of a molecule to a vector, and we're not going to talk about any of them. Again, because it's tedious and boring. But there's one approach, and you can read about it. Go on ChatGPT, type in this thing, graph neural networks. What graph neural networks do they're really efficient at taking the graph structures of anything and converting it into vectors, right? But it doesn't matter, because all we're doing is taking the structures of molecules, converting it into vectors. That vector is going to be collapsed to a single dimensional output between 0 and 1. And when you run predictions, after you've trained your model, this is what you get, right? So what we've done is taken our trained model here and ran 7,500 predictions, nothing, right? On some unseen chemical library. And what we can see, we have prediction score as a function of just molecule rank based on prediction score. And we can see that the overwhelming majority of molecules have a low prediction score, meaning the model doesn't think it's antibacterial, which fits our mental model of the world, right? Most molecules that we look at are not antibacterial, and that's reflected in how this model is thinking, right? So good, check. And then a small percentage of molecules exist above some prediction score threshold, which is high, meaning that this small percentage of molecules the model thinks are antibacterial, right? So now what you do is you focus all your energy on these molecules here, and you ask, okay, out of all these molecules that the model thought were antibacterial from this chemical repository that I showed it from the internet, which of these are actually structurally novel relative to every known antibiotic ever, and here's one, and it works, okay? That's a typical, discriminative workflow. Does that make sense? Because we're going to build on this now. Okay. So I have a student, Autumn, and she starts in my lab a few years ago, and she's like, that's cute, and it's fine, and it's boring, and I go, okay. And then she's like, all this stuff, like the activation energy for non-computer scientists to be doing computer science stuff is high, right? Because you have to learn a whole new field in order to do this properly. And she said, that's annoying, and if we're actually in the business of, trying to make antibiotics fast and cheap, we need to democratize these technologies to the best of our ability. And I said, that's a very fair point. So she developed this thing called the escape model. If you go on your phone right now and type in escape.mcmaster.ca, you can start to play with it. What she did is gather training data against representative isolates of each of the escape pathogens, which are just bacterial species that like to kill people. And then she trained a set of molecular property prediction algorithms, largely like we just talked about, for each of these different isolates. And she made this thing called the escape model, which is a public, freely available resource. And what it enables people to do is take their own sets of chemicals that they like to work with, upload them onto this website, which is hosted in our lab, and what it will output are AI-guided prediction scores for every molecule about whether these models think that every input molecule has activity or doesn't against each of the escape pathogens, right? It'll also do things like calculate molecular weight, log P, structural similarity to the training data set, et cetera, et cetera. But the idea here is that we wanted people who don't care about computer science, who don't want to learn about computer science, to have this technology readily available to them at all times if they want to use it, and if not, that's fine too, right? So up until yesterday, this said in review. It's in revision now. You should see the revision list. It's the longest revision list I've ever seen in my life. I was scrolling, and I thought they copied and pasted it twice, and they didn't. So I was talking to Autumn yesterday, and she's like, what is wrong with my life? And I'm like, I don't know, that's for you to figure out. But yeah, go pressure test that. If something breaks, let me know. Okay, so everything I said is fine. I didn't lie to you. We can take high-quality training data sets, train a molecular property prediction model, and then use that model to run predictions on unseen chemical spaces, and the models will work, right? But here's what is suboptimal about that workflow. Discriminative models can only really explore about 1 billion molecules before it starts to take too long, like more than a month, right? Even with really good computers. But the problem is drug-like chemical spaces tend to something big, right? Some people say 10 to the 60, some people say 10 to the 20. I say 10 to the I don't know because it's a fight I don't want to get into, right? But it doesn't matter because if it's 10 to the 60 or 10 to the 20, it might as well be infinity because our planet has 10 to the 18 grains of sand on it. You know what I mean? So the question becomes, if a discriminative model can only look at 1 billion, but our sandbox is 10 to the something big, how do we search more of the vastness of this drug-like chemical space? And the answer is generative modeling, right? Design molecules that do something useful. Okay, that's not a new idea. Like this idea of designing molecules that do something useful is decades old. The problem is the overwhelming majority of models that have existed to do this design molecules atom by atom. Hang on, I just want to check time. Oh, we're good. Atom by atom, right? And while that's great to access any theoretically valid chemical, right? The problem comes when you walk that molecular structure down to your chemist buddy down the hall, and then she laughs you out of her office, right? Because either she can't make it, because the technology doesn't exist, or she can make it, it's 20 steps, and it's going to cost you $5,000 a milligram, right? Which for me is a non-starter because I'm an early career researcher and I'm broke. So the question becomes, how do we do this at scale and cheaply, right? And when I say this, design molecules that are easy and inexpensive to synthesize for wet lab validation. Does that make sense? Is this like a reasonable line of thinking? Okay. So here's how we are thinking about it. And again, this could be wrong. And if it's wrong, tell me so I stop spending money doing this. So we developed this thing called SynthMol, which is a molecular design algorithm that designs molecules instead of atom by atom. It uses predefined molecular fragments, right? So these are multi-atomic molecular building blocks for which we know every structure, and we know how every molecular building block will react with every other molecular building block using a predefined set of reactions, okay? So this chemical space expands exponentially, right? So with 150,000 molecular building blocks, like little Lego bricks, and 50 reactions, we can access a space of 46 billion synthetically tractable molecules. When I say synthetic tractability, our current success rate of synthesis using this type of approach is greater than 80%, right? And we can contrast that with a synthesis success rate using models that design molecules atom by atom to like 2% or something. Okay, so, and this is a small number now. Our lab has this number up, I think, to like 450 billion or something like that. And it's always expanding. But here's sort of like the framework how we're going to do this, right? So the task now is this, and it's super simple. I have a big bucket of building blocks and another bucket of reactions. Can I get a model to learn how to pick which building blocks to stick together with what reaction and make an antibiotic? Does it make sense? Perfect. So, like I said, the algorithm is called SynthMol. We published a paper about it in 2024. We have another one coming out April 23rd. But I'm going to talk about the architecture for April 23rd because it's better. All right. So this is how SynthMol works. So we have molecular property predictors. We just talked about these, right? We just talked about all the discriminative stuff. So here's 2 discriminative models, like we just talked about, trained on data from the lab. One to predict the activity of molecules against Staphylococcus aureus. And here's another little one for solubility, right? So why these 2 things? So something to keep in mind if you're ever interested in drug discovery is what's called a multi-property optimization task, right? And here's how I teach this all the time. If I have a patient in front of me who has a bacterial infection, what I want to do is give them a molecule that kills their bacterial infection and lets them go home, right? So that is very, very different than finding a molecule that can kill a bacterium in a dish, right? It's really, really easy to find antibacterial molecules. It's very, very hard to find molecules that can become clinical antibiotics. Why is that? Antibiotics are poison. They just happen to be bacterial-specific poison, right? So things that look like really good antibiotics in a dish could be things like bleach, right? Unfortunately, bleach, as good of an antibiotic compound as it might be in a dish, can never become a clinical antibiotic because it doesn't have all of the other properties that are required of clinical drugs, right? Can't be toxic, has to have good pharmacokinetic properties, et cetera, et cetera, et cetera, right? Okay. And that's what differentiates, molecules like, like penicillin, which is clinically viable, from like fire, which is a good antibacterial molecule, but can never be clinically employed because you'll sterilize your infection, but you'll also kill your patient, right? So this is our sort of little toy data set to begin doing multi-property optimization, right? And we picked solubility because this is a roadblock we always run up against. Okay, so we have two property predictors, a model to predict whether a molecule can kill staph, and another totally separate model to predict whether a molecule will be soluble, right? So we have these two things that are like teachers, right? And then we have this thing which is called a reinforcement learning model, which, and I'll walk you through this a little bit, learns how to navigate this really, really large combinatorial space of building blocks in order to take 2 or 3 building blocks, stick them together in a manner which, when shown to the property predictors, both property predictors say, good job, you made a good molecule, right? So this reinforcement learning model, which I've shown here in blue, is itself a neural network. So what it does is it looks at the structure of all 150,000 building blocks, picks the one it thinks is best for both properties, then it finds every synthetically compatible building block with the first one that we picked, finds the pair of building blocks that has the highest combination of prediction scores for staph activity and solubility, makes this molecule in silico, shows it to the two property predictors. The two property predictors give them their score based on real-world training data. And then we update this reinforcement learning model by asking what is the difference, right, between the prediction scores from the reinforcement learning model and the prediction scores from the molecular property predictors, which are teachers, right? And then we try to get the reinforcement learning model to most closely match the property predictors for every building block or pair of building blocks it selects, right? So this is called reinforcement learning. Basically, we're using these property predictors to guide our reinforcement learning model to get better and better and better on successive molecular generations. So in this sort of paradigm, we might design 10,000 molecules, meaning 10,000 rollouts, and after every molecular design, the reinforcement learning model is asking these property predictors, how'd I do? If it makes something that is bad, it knows not to make that again. If it makes something that is good, it will continue to make stuff that is good, right? Here's a molecule that we designed using that approach. We named it Synthesin. We wanted to use it to treat an MRSA staph infection. It's bacteriostatic, and when we put it in mice, it halts the progression of infection. Vehicle control doesn't. Vehicle control looks gross and inflamed and red, and our treated mice look much better. Okay. We're working to make Synthesin easy to use as well, or Synthesin, jet lag. Synthmol easy to use as well. Give us a couple months. We're working on it. The idea here is you'll be able to upload your own data sets. We'll train models for you. We'll run molecular designs for you. In a couple days, you'll get an email with the list of molecules that could be useful for your task. That's the idea. Okay, I have a few minutes left, so we're going to go through this quick. Everything I talked about so far was like hit finding, right? Can I get an AI model to find me a molecule that is potentially useful? But that's this much of antibiotic discovery, and the rest of it's this. One of the big bottlenecks in preclinical antibiotic discovery is mechanism of action elucidation, right? I found some new molecule using a phenotypic approach. What does it do? So we tried to tackle this problem too, specifically in the context of inflammatory bowel disease. So IBD, inflammation of the gut, 2 million Europeans, 1.5 million North Americans have IBD, and patients with IBD can get these things called adherent invasive E. coli infections, right? That can't be treated with existing antibiotics because existing antibiotics kill all the good bacteria in your gut, which is helping suppress infection, right? So if you take a broad spectrum antibiotic and you're an IBD patient with adherent invasive E. coli, you get worse. So the whole principle behind this was, can we find a narrow spectrum drug for AIEC? No AI here. We did a screen against a clinical AIEC isolate and got lucky. We found this molecule called enterololin, which is structurally novel relative to every existing antibiotic. And when we tested it against a phylogenetically diverse panel of both pathogens and commensals, we observed that it was only active against members of the Enterobacteriaceae family of bacteria, of which E. coli is one. Enterobacteriaceae make up about 1% of the healthy human microbiota. So we said we can disrupt 1% and still be okay, because we're not touching 99%. So here's a molecule. Denise, who was the grad student working on this project, is really smart, and I said, hey, Denise, you have this molecule. It's really cool phenotypically. It has all the right things we need it to have. It's non-toxic. It has relatively narrow spectrum activity. Go figure out what it does. And she said, I don't want to do that. And I said, well, tough. But here's why she's smart. Instead of going right to the bench, she went to the library. She looked at the structure of the molecule and asked a very specific question. I have two pieces of data. I know the structure of my molecule and the phylogenetic distribution of activity, right? She asked, what other molecules from the literature have structural features of my molecule and also share this same relatively specific distribution of activity across different species? There were 5. All 5 of these molecules have this green and blue sort of bicyclic ring structure somewhere kind of in the molecule. These are all Enterobacteriaceae specific. They all target the exact same protein complex, the LOL-CDE lipoprotein transport complex. So Denise comes to me, she says, hey, John, I have this idea. I think enterololin is inhibiting LOL-CDE. I said, okay, and she's like, but I want to be a little bit more sure. We call up a good friend of mine, Regina Barzilai from MIT. At the same time, we were starting to begin to think about MOA elucidation for enterololin. Her lab developed a diffusion model, which is a type of AI model, it doesn't matter, called diffdoc. And what diffdoc does is takes as input the structure of a chemical, the structure of a protein, and through how diffdoc works, makes a really, really efficient, fast prediction about whether a molecule sticks to some protein, right? So we emailed her, well, it was her student, Gabriel Corso, who works in London now, the structure of the LOL-CDE complex from E. coli, because we had that, the structure of enterololin, and in about a minute and a half, we got a prediction that put enterololin in kind of the business part of this protein complex. And we looked at that, Denise and I, and we said, this is biologically plausible, right? Let's go pressure test this prediction, which took 2 minutes, in a laboratory and see whether it's right. And through about 6 months of work, which is about a quarter of the time it normally takes to do a mechanistic workup, we had multiple orthogonal experiments that suggested strongly that enterololin does indeed inhibit LOL-CDE at the exact site that was predicted by this model. So now we're trying to scale this, right? If it worked once, it could work again. And now we're just trying to figure out how can we use these other, protein ligand prediction algorithms and scale them and tune them specifically for antibiotic mechanism of action elucidation tasks. We put enterololin in a mouse oral gavage with an AIEC infection. It statistically, significantly decreased AIEC burden, and it didn't induce dysbiosis while we were doing it. So cool. This molecule, for full proof of concept, we have a spin-out company that's working on enterololin to make it better and hopefully push it into humans. All right, I'm done. If you fell asleep, wake up now because I want you to remember this. For antibiotic discovery, all ML models should be able to do is guide humans to make better decisions at every step. That's it. People who are like, AI is going to cure every disease in 10 years, it's not, and they're only saying that because they're trying to get more investment, right? So don't believe them. 2, we can apply some AI architecture to navigate maybe every step of antibiotic discovery. The issue isn't the availability of existing AI architectures, it's nearly always the data, right? Like I was saying, 80% of the success and failure of ML in drug discovery is data acquisition, data representation, and model output interpretation. Antibiotics uphold the entirety of modern medicine. If we can't control infection, we can't do anything. And if you want to chat, just send me an email. Most emails I get are annoying, yours won't be. They do all the work, they pay for everything, and I answer emails. So thanks for listening. I'll talk to you later.
Well, I'm sat there. I'm pretty old, actually. And it's such a privilege to be able to hear you, John, actually. You know, I always expect the unexpected. You know, as a scientist, I've learned you always think, well, you've run out of ideas, you've run out of energy, and you've got all these problems in the world. And then you suddenly sit there and you actually hear a brilliant scientist talking about brilliant work. And a modest, brilliant scientist as well. The other important thing about this, I'm going to ask you a question. We're not allowed to, but I'm going to do it anyway because I'm the president, right? So a lot of this is open access, right, in terms of the technology. So a lot of the things will come out of AI won't be open. You know, I was involved in the early phases of DNA sequencing with genomics. Do you want to comment on that, about how, what will be available for the people in this audience to actually develop their ideas in this area?
Yeah, so what I'm going to say isn't reflective of what everybody thinks. So in this space, antibiotic discovery specifically, I think about the AMR problem as like a public health problem, right? And if it's a public health problem, that is inherently not financially super attractive. It should be treated as a public health problem, and that means it should be funded largely by governments. That's what I think. Yeah. Because governments have a vested interest in keeping their population healthy, healthcare systems running, et cetera. So in that context, I feel that every antibiotic data set and every antibiotic prediction model for anything in this space should be open access, easy to use, et cetera, et cetera. But is that like too utopian? I don't know. But that's what I think. So like everything that we do is free, open source, transparent, et cetera. Now, the question is, if I'm trying to get Roche, right, will Roche ever give us all of their antibiotic screening data? Well, we have evidence for this, and it's no, right? Because as soon as they do that, even if the antibiotic screen itself isn't valuable, their molecular structures are valuable to them, right? And they don't want to show the world what they have. But there are ways around this, right? So for example, you could take all of Roche's antibiotic screening data, train a model on that, and then release that model for free without showing the world their chemicals file, right? So I think there are ways around it. You have to get a lot of people at these big institutes, I'm sure, on board. But I think, you know, as a community who's trying to solve AMR, and we know no one's getting rich off an antibiotic, right? It's a break-even proposition at best. I feel like there's a real argument to be made, both for, you know, government types and industry types, to say, like, let's just fix this problem, and, you know, you can go get rich making Ozempic. You know what I mean?
Yeah, well, I'm going to add something. So, I mean, what we're talking about is this interface between science and the social and society, right? Mm-hmm. And I think what we're talking about, we will have to curtail the conversation. We could talk all day. Yeah. But we're talking about, I mean, also you've been able to perform a spin out. So in a sense, this interlink between basic science, applied science, and open access, and the community. Mm-hmm. You know, I've been involved in making affordable medicines a lot of my career, but you can still work with commercial entities also who are doing for profit.
Oh, yeah.
So I'm going to leave it at that, but I wanted just to touch on that because I think you were skirting around it without having enough time to sort of go into it. So I want you to, I mean, first of all, I'm very grateful for everybody who's got in here today. You know, it is the last day of the conference, half day, and it's a great turnout, actually. And it's a great, I think we've all realized what an absolute privilege it's been to hear this pioneering scientific area. So we're grateful for coming over, John. Okay.
Thank you so much.